Alright, now it's time to discuss the vascular disease of the liver. Before we go through this, let's go back to anatomy again. I want you just basically to remember that the liver have 8 segments. Right loop contains 6 segments, and the left loop contains 2 segments. And this is the famous caudate liver segment. We will, let me tell you now that it's actually drains in the inferior vena cava separately. The drainage of the caudate loop, which is number 1, doesn't go through the hepatic veins. It goes directly through the inferior vena cava, and this has a clinical significance. We will talk about it later. Alright, so this is the portal vein along with the hepatic artery and the bile ducts, branches inside the liver, and the blood supply of the liver goes out or drains out from the liver through 3 hepatic veins, right, middle, and left hepatic vein into the inferior vena cava. That's fair enough. So what's the structural unit of the liver? The structural unit of the liver is called the hepatic lobule. The lobule is a hexagonal shaped structure with a central vein in the middle and 6 portal triads at each angle. Each hepatic lobule is formed of 6 acinas in a triangular form. When 2 adjacent hepatic lobules are facing each other, and if you draw this rectangular shape between these 2 central veins, you're going to have what is called the hepatic acinus, which is the functional unit. If you draw a triangle between the 3 central veins of 3 adjacent hepatic lobules, you will get 3 hepatic acini. Alright, what's the importance of the hepatic acini? That each acini has been categorized into 3 zones. Zone 1, which is closer to the portal triads at the periphery of the lobule, and zone 2 in the middle, and zone 3 near the central vein. Remember, zone 1 is the closest one to the hepatic artery branches, so it has rich oxygen content. This is the liver acinus again, central vein in the middle, and at each angle there's a portal triad of a bile duct branch, portal vein branch, and hepatic artery branch. The blood flows from the portal vein and the hepatic vein toward the center of the liver acinus to drain into the central vein, while the bile collects from the liver cells, the bile canaliculi, to drain into the bile ducts in the opposite direction. Alright, here again, these are a bunch of hepatic lobules, hexagonal shapes, adjacent to each other, the central vein in the middle, hexagonal shape, 6 apexes, each one have a portal triad. Again, the blood comes from the portal vein and the hepatic artery branch, mix inside the hepatic sinusoid, this is the sinusoid, and drains at the end in the central vein towards the inferior vena cava through the hepatic veins, while the bile is going in the opposite direction to drain in the bile ductule, then the bile duct. The last thing about anatomy we want to just remember here that how the portal vein forms. The portal vein, this is the spleen, the liver, and this is the inferior vena cava. The splenic vein drains the spleen, and while it's going toward the liver, it merges with the inferior mesenteric vein and the superior mesenteric vein. When the three of them merge together, they form the portal vein that enters the liver. Alright.